Hello, my name is Shannon and I'm here today to provide a quality assurance and performance improvement staff education training to increase patient satisfaction through communication. Today's workshop should only last about 20 minutes. We will spend approximately 5 minutes on each of the 4 topics on today's agenda. We'll start the program reviewing our objectives and focus area, then we will review current policies, programs, and methods that already exist for increasing communication between provider and patient. Then we will move on to discussing recommended best practices related to communication. And then to end today's program, we'll have you all practice with a group exercise. As previously mentioned, our program will be focusing on communication. Specifically, we'll be focusing on communicating clearly with patients, and secondly, on how to encourage our patients to ask questions. Once today's program is over, hopefully you will walk out of here with 1, a better understanding of the importance of communicating clearly with patients, 2, a better understanding to why patients may be apprehensive to ask questions during an office visit, and 3, know new techniques to increase communication between you and your patient. Diving right in, let's talk about communicating with patients and discuss some programs and policies that are currently in place. To begin with, clear communication is one of the most important factors for providing patient care. As we've learned from our patient satisfaction surveys, patients can often get confused if they have a large care team and may misinterpret their care instructions if they hear it from multiple people. There are multiple programs that have been implemented that can improve communication, but 2 examples that are really helpful are the Teachback method, that we'll be practicing shortly, and the Top 10 Principles for Plain Language. The Teachback method is an important tool because it encourages patients to summarize what the care provider and the patient discuss during their visit. This allows patients to clear up confusion they have right on the spot and encourages patients to ask questions to help them understand their treatment plan and get themselves more familiar with their diagnosis. In addition, the Top 10 Principles for Plain Language is also important because it reminds providers to use examples and words the patient is easily going to understand. This means removing complicated medical jargon and talking to the patient with clear, easy to understand verbiage. In addition to the strategies, some hospitals have implemented policies within their organization to help vulnerable populations, such as places will require elderly patients to have a family member in the patient room to hear the care plan and help make decisions with the patient. This way, the patient has a second set of ears helping them understand the plan, and the family members will also are encouraged to help questions to make sure everyone is familiar with the care plan and know exactly what needs to be done once they leave the office. Many hospitals also make use of interpreters for those who do not speak the primary language at the hospital. Patients have a right to these interpreters so they know what the care provider is saying and are not confused or misinterpreting information due to a language barrier. Here's an example of types of language services an interpreter may offer. Some hospitals may offer more options than others depending on the size and resource availability. Now that we've had a little overview, let's dive deeper into some of these practices. A key component to effectively communicating with patients is encouraging them to ask questions, so providers can clear up any confusion. However, oftentimes, as a provider, we may say, "Do you have any questions?" and the patient unfortunately will say no. Unfortunately, according to the CDC, this is very common, as in 1 in 10 Americans will leave a doctor's office very confused about their care plan and may have no idea what they're supposed to do once they leave the office. There are many reasons why a patient may not ask questions, such as they're embarrassed, or they do not know where to start, or there's the language barrier and they're just scared they're going to ask something wrong. By implementing the Teachback method on the spot, this encourages patients to have a dialogue with their clinicians and can clear up any misinterpretations right then and there before the patient has time to leave the building and be confused about their care plan. The Teachback method encourages care providers to use plain language, supportive body language, and make use of non-shaming, open-ended questions to help the patient effectively understand their care plan. This tool also emphasizes the responsibility on the clinician to explain information clearly so the patient is able to easily digest what's being heard and they can repeat back what's discussed. There are 4 steps to remember when using the teach-back method. Let's go over them. First, the provider should start off by talking about the care plan and the diagnosis and treatment and everything that the doctor wants to communicate to the patient. And when they're doing this, the best thing to do is to use plain language that the patient can easily understand, avoid medical jargon, and sometimes what can be really helpful is using supplemental handouts and pamphlets with pictures as a reference. These are especially helpful for those who may speak a different language, and having the pictures there can help be a reference and supplemental material that can help the patient understand what's being discussed with them. 2, encourage the patient to ask questions. Ask the patient what questions they have. Do this multiple times throughout your conversation. Avoid asking, "Do you have any questions?" because they may default to no if they're unsure. We want to keep these questions open-ended by asking, "What questions do you have?" 3, ask the patient to explain in their own words what they will do once they leave the office. Let them know this is not a test and they should not be embarrassed if they don't know. This is to help find areas where they are confused so that you as the provider can clear up with the patient what needs to be done once they leave the office and everyone is on the same page. And then finally, as a 4th step, re-explain any information the patient may be mixed up or seem confused about. This is really the opportunity to really explain in a different way that might be easier to digest. Such as, this is a good time to, if you haven't already, use that supplemental pamphlet or handout as that reference that has pictures or diagrams that can really walk through at an easier way for the patient to understand. To end today's program, we're going to have you all try the teach-back method in a group exercise on your own. This exercise will give you experience with the teach-back method and get you more comfortable so you can implement it with your own patients in your own clinics. The goal of this exercise is to create open dialogue with the patient to make sure they understand their care plan when they leave your office. At the end of the exercise, you'll be able to 1, have a better understanding for promoting dialogue between you and your patient. 2, know key phrasing terms for encouraging your patient to ask questions. 3, identify new techniques for increasing a supportive and shame-free environment. So here are some directions for what you guys will be doing. First, you'll find a partner. Anyone in the room, just groups of 2. One person will act as the care provider and the other will be the patient. We'll have each of you be able to act as both roles and do a role reverse. So that way you guys can all have this turn being able to do each role. Each clinician role should go through each of the 4 teach-back method steps with their patient. We'll give you a scenario in a second so that you have something to work with and a problem that you'll be able to go through step by step with. And like I said, you'll switch positions once you guys have done, so you each have a chance to go through each of the roles. This should only take about 5 minutes each. Here's a scenario for you guys to use when you guys are practicing your teach-back method. Becca is a 47-year-old Latina mom who has recently been diagnosed with high blood pressure and is considered obese. Although Becca speaks English, it's not her first language. As her care provider, you are discussing her care plan for reducing high blood pressure through healthy eating and exercise. You're discussing ways to incorporate nutritional foods into her favorite cultural meals. Utilize the teach-back method to role-play how best to have this conversation. So when doing this, think about those 4 steps that we've talked about earlier for when you're discussing that care plan, all the way between asking questions and then asking them to repeat back what was discussed today. And then always remember, re-explain any information at the end that the patient may seem unclear about. And under each of these bullet points, just remember to think about some of the things that we've already discussed today that you can implement into your conversation, such as using that plain language. Again, always avoid that medical jargon and terminology. Make sure it's wording that the patient that you're working with easily can understand. Just some other additional things that we haven't talked about already, but that you should be doing is sit and don't stand. Be at the same level as the patient. This helps let them know that you're there to as a friendly person and making eye contact with them, and you're not just looking up at them and looking down. And always use a caring tone of voice. And then again, as you're asking those questions, let's keep them open-ended. Don't use yes or no questions. We want to create that dialogue so they feel comfortable asking questions. One phrasing that I like that I personally like to use, it is from AHRQ, is that we discussed a lot of information today. What can we review again? That opens them to think back to the conversation and really think about what they don't know and what they don't understand. And then as we move on to asking them to repeat themselves or repeat what's been discussed, make sure again that you let them know this is not a test and they're not being judged. This is really for their benefit of making sure that everything's cleared up, and that we just want to know what they don't understand, so that when they leave the office, they're feeling comfortable. And just always use some friendly cues so that they know that you're listening. A smile and a nod. That way that they know that you're taking them seriously and you're not trying to rush out of the office to go meet another patient. And then finally, re-explaining that information that they might be unsure about. And that's when you can use additional resources that you may not have already used. At this point, we're really just trying to figure out what that confusion is and how can we address that to make sure everyone is leaving in a clear, with a clear message of how they're going to do their care plan once they leave your office. So this concludes today's training. Please feel free to contact me if you have any questions. Hopefully this has been of help for you, and we can increase our patient satisfaction through the teach back method. And here are some references for you. Thank you.